prior to MRI being available, we had to rely on contrast, which is dye, injecting into a joint and taking either an X-ray or a CT. And that really just gives you a limited sneak peek into what's going on. You can see if there's a rent or a hole in a piece of tissue, but you really don't see the entire anatomy of the tissue. MRI allows us to completely look at the anatomy. It allows us to see how large a tear might be, how long the tear has been there, and it gives us a much more bigger picture of what's going on inside that particular joint. When I'm evaluating an injury, to make the decision of whether or not to use a CT or an MRI, the decision is based on whether I'm really looking at the bone specifically or soft tissues. CT is basically going to give us a three-dimensional reconstruction of the bones. So if there's a fracture, for example, that extends into the joint and we want to see if there's a little step off, a CT would be better indicated for that. If, however, we're looking for soft tissue injuries, maybe a rotator cuff tear or cartilage injury, then an MRI would be better.